Hey Doc, this is the Invisalign case you had some questions about. More than happy to meet with you. I just thought I'd do a quick video. Um, your concern was this first proposal back from Invisalign just didn't look right to you, and I would agree. I can see what it is immediately. Has to do with the root axial inclination of number 7 and number 8. For whatever reason, they just didn't correct it. So, as with all modifications, you click on new modification. I've already done that. This screen pops up. Click on tooth. And then what I'll do, click on the tooth, and then I want to choose the correction plane that I'm trying to do. So I'm looking for crown angulation. So I'm going to click that one. I can use these arrows here. I could manually put it in, or I can come over here and use the arrows to tilt it like so. Let's do the same here. Always ignore the space that's created on this digital model. They have no idea if that tissue is going to fill in or not. Let me just quickly reference the Tarnow article that talks about whether or not you're likely to get papilla fill here. If you measure the distance from the crest of the bone to the contact point, if it's 5 millimeters or less, you'll always have papilla fill. For each millimeter above 5 millimeters that you get a decrease in the percentage of papilla fill. That computer, I doubt this computer doesn't know where her crest of bone is. I would go to the original and say, as the teeth are moving, are we likely to get crest of bone there to follow suit? And I would say yes. Moral of the story, don't worry about that space right here, right now. Down the road, if it's there, we can talk about doing some IPR and then pushing the teeth together, which will increase the chance of fill there. Really, everything else looks good. I wouldn't change a whole lot. I'm always looking at the overjet of the posterior. If the patient has canine guidance, are we discluding the back teeth? Based on this setup here, we don't. So I would correct that overjet somehow. And or increase the overjet here. So let's just do that. Let's select these two teeth. Go to root torque. No, I want crown tip to the buccal. Something like that. And then I want to do crown tilt to the lingual for the canine. Obviously keeping in mind how this is affecting the aesthetics. I actually don't like that. Yeah, this will be a tricky one to get aesthetically right and maintain canine guidance. I know this wasn't your original complaint, but as you can see, as we're starting to increase the overjet here, we're decreasing the aesthetics as these look more pronounced than the canine. I would actually leave that as is, and then in the next round of trays, we will fine tune it. Most likely you're not going to get 100% expression of what you're seeing here. My gut tells me that it's probably going to be pretty accurate, and then we can fine tune this whole section to get the occlusion just right so that we have increased overjet of the posterior teeth with the proper canine guidance. Same on this side. All right. Other than that, looks good. I guess one last thing. If we ever choose to do IPR, it's on patients with these triangular teeth on the lower. These are periodontally high risk teeth because of the open spaces. So if the patient did have a Bolton discrepancy, you needed to increase the overjet for any reason, and the patient didn't have an airway problem, then you would more likely consider IPR in these kinds of teeth. So not against IPR, just has to be the right time. And you may be asking, why am I increasing the overjet of the back teeth? Where do our fractions come from? They come from lateral forces of posterior teeth because there's no canine guidance. Canine guidance protects back teeth during lateral excursions. So when you grind to the left or the right, the back teeth should never touch. When they do, that's when we get problems. Back teeth should touch in MIP, and that's it. No other times, unless you have group function, which is not what we're trying for here. There's no reason to create group function in this scenario. So I think it's just a matter of moving the lower teeth in the posterior section and the upper teeth so that they line up well with proper overjet so that it aligns with the aesthetics of the canines. I think it's going to be tricky. I know I said it was done, but let's do one more thing. So I can also decrease the risk of there being lateral interferences by intruding them a little bit. We can also do an enamelplasty. So when you're all done, there's things that you can do to decrease the risk of these teeth being affected during lateral excursion. That looks better. All right. Take care, bud.